Cigarette smoking, a behavior with lasting health effects. My name is Erin King, and I'm a nursing student with Indiana State University. This presentation is geared towards adolescents and adults, both smokers and non-smokers alike. At this point in the presentation, I ask that you please take the attached PreTest and see what you know prior to listening to the rest of the presentation. Cigarette smoking statistics. Almost every organ in the human body is impacted by the negative effects of smoking cigarettes. When people think of the organs that would be harmed by cigarettes, the first thing they think of is typically the lungs. They often don't think that it affects the entire body. Cigarette smoking is the #1 cause for preventable deaths in the United States. The risk of dying as a result of smoking cigarettes has increased in the United States over the past 50 years, which is interesting because over the past 50 years we know more about the harm that it causes. More than 10 times as many U.S. citizens have died prematurely from cigarette smoking than have died in all of the wars fought by the United States. That is an astronomical number, and this is preventable. Health knowledge disparities. Extensive information is pushed out to the public every year regarding the health risks of cigarette smoking. In a 2018 study regarding the knowledge gaps about the health effects of smoking among adolescents, about 94% of adolescents were aware of the risk of lung cancer associated with smoking. This is the most common one that is pushed out to the public. And so most adolescents and adults alike are very familiar with this. However, it's not uncommon for people to underestimate the level of severity of health risks associated with smoking tobacco. In this same study in 2018, only about 1/3 of adolescents knew that smoking causes vision loss, and the same number of adolescents were aware that the increased risk of bladder cancer was also associated with smoking. So while 94% of these adolescents knew about lung cancer, only 1/3 of them knew the risk of the increased risk of bladder cancer and possibility of vision loss that was also associated. That's a huge difference. With as much education that is pushed out each year, there is equally, if not more, myths out there in the general public in regards to smoking tobacco. One that you often hear is that smoking is a choice or a habit, when in fact, it is only a choice the first time that someone smokes a cigarette. After the first cigarette, the chemicals in the brain begin to change and can quickly become an addiction. Another myth is that filters decrease the harm caused by cigarettes. And this is an interesting one because cigarette and tobacco companies actually use this as a marketing tool. They have specific filters that are deemed as light cigarettes. And while the flavor may be light, it is no more or less harmful to the individual smoking them. Filters in cigarettes actually increase addiction by making the smoke particles smaller and the nicotine easier for your body to absorb. This fact in itself actually blew my mind. This was not something that I knew prior to this research. Another myth that is often heard is that if I only smoke a cigarette occasionally, like in a social situation, it's not really a big deal because I'm not addicted. When in fact, smoking one cigarette has been found to cause immediate damage. Each cigarette that you smoke harms your heart, lungs, and blood vessels. It has been found that smoking a few cigarettes per week can lead to a heart attack. And another thing that I hear often is, why quit now? I've already harmed my body. The harm's already done. But studies have shown that 20 minutes, just 20 minutes after smoking a cigarette, your body begins the healing process. That is unreal. By quitting, you decrease your chances of negative health effects. Just think 20 minutes after smoking. That's for most people prior to even lighting up another cigarette. Their body already begins to heal. Imagine what quitting would do for your body. Getting down to the individual systems, what are the respiratory effects of smoking? Smoking is known to cause lung diseases such as chronic obstructive pulmonary disease, or better known to most people as COPD, which includes emphysema and chronic bronchitis. Smoking is the leading cause of COPD and is responsible for up to 8 out of 10 COPD-related deaths. Unfortunately, COPD is not curable. Treatments are available to manage symptoms, but the damage from smoking is already done. Early signs of COPD may seem mild, like a nagging cough or some shortness of breath with activity or some wheezing, but as the disease progresses, patients with COPD experience weight loss, blue lips or fingertips from lack of oxygen, and difficulty catching their breath or speaking. Smokers are 12 to 13 times more likely to die from COPD than non-smokers. The respiratory system takes a huge blow from smoking cigarettes. What are the cardiovascular effects of smoking? In the year 2000, so at this point 21 years ago, more than 1 in 10 cardiovascular deaths were related to tobacco smoking worldwide. Now, smoking causes cardiovascular disease, also known as heart disease. In 1 in 4 deaths from heart disease in the United States, smoking is a factor. 1 in 4 deaths. Smoking can raise triglycerides, lower good cholesterol, and make blood more likely to clot or more sticky, which increases the risk of stroke or heart attack from blocking a blood vessel. Smoking increases the buildup of plaque in the arteries and damages the cells that line the blood vessels, causing them to thicken and narrow. Smokers are 2 to 4 times more at risk for stroke than non-smokers. 2 to 4 times more likely to have a stroke. That is a big difference. Increased risk of cancers. Smoking. It has been known for years that smoking causes most lung cancers. Nearly 9 out of 10 lung cancers are directly caused by smoking cigarettes. In fact, if no one smoked, cancer deaths in the United States would be decreased by 1/3. People often relate smoking to lung cancer, but don't always think about the effect that smoking has on the entire body. Cancer increases the risk for multiple types of cancer, such as bladder cancer, types of blood cancers such as leukemias, cervical cancer, colon, rectal cancer, esophageal cancer, kidney cancer, ureteral cancer, laryngeal cancer, liver cancer, oropharyngeal, also known as mouth or throat cancer, pancreatic cancer, and stomach cancer. That's a lot of cancers, all that could be decreased in incidence if you did not smoke. Quit smoking now. By quitting smoking, one reduces the risk for adverse health effects, including lung diseases, cardiovascular diseases, and multiple types of cancer. Quitting smoking decreases the risk for heart disease. In just 1 year after you quit smoking, your risk for heart attack plummets. After 5 years of being tobacco-free, your risks for cancers of the mouth, throat, esophagus, and bladder are literally cut in half. Your risk of stroke is close to that of a non-smoker within 2 to 5 years, and within 10 years, your risk of lung cancer is also cut in half. Quitting smoking reduces the risk of an early death and can add as much to 10 years. That's a decade to your life. I want you to think about how much you spend on cigarettes per week, or how much an average person that smokes would spend. Multiply that by 52 weeks. That's how much that a smoker or someone that you know that smokes could save in 1 year by quitting today. For many smokers, this is the cost of a vacation. There are multiple resources out there for help and support with quitting. I've listed some on this page. Some of these are free resources and even include apps for your phone. If you need help quitting or know someone who does, please look into these support sites. Quitting now could be the difference between life or death. Thank you for taking the time to listen to my presentation. I hope you found it very informative and that you're able to learn something from it and share something with people that you know in regards to the risks of smoking, as well as options and support sites for quitting. Please remember to take the PostTest to see what you've learned today. Thank you again.